All right. Good morning, Queensland, and good morning to all of our Facebook Live followers. So we've just had a bit of an update. So we actually have today one new local case which is under investigation. So we'll be giving some more information out later on today, and Dr. Young will be speaking to this. It's just come in, but as a precaution, as this is a student who's around 13 years of age, as a precaution, we've actually asked the school, Sir Thomas More at Sunnybank, to send the students home today as a precaution, and they are to stay at home until we get more information. So it's just come to hand, so I apologise for being a little bit late this morning, but we'll get more information out to people later on this afternoon, and like I said, it's under investigation. We need to do more work. We also have one overseas acquired case. It's a person on a ship, and we talked about that a bit late yesterday. Late yesterday we also talked about the truck driver. So Dr. Young's going to today give some very detailed information about where this truck driver visited, especially Garden City. Now, hopefully, fingers crossed, everyone who was going into that shopping centre was wearing a mask, but also he did spend some time in some areas there where people had their masks off, of course, where they were eating. So it's absolutely very critical if anyone went to those areas, and I really am asking the media and social media to put all of this out, because if you're at any of those places at any of those times, it is absolutely imperative that you get tested and watch out for symptoms. So once again, it's really important, Queensland, if anyone has any symptoms, to please get tested. We've also set up a Queensland Ambulance Centre testing clinic. Will open up at 51 McKechnie Drive at 8 Mile Plains. So we have 21 active cases. We've had 11,940 tests over the past 24 hours, and Queensland Health did 23,807 vaccines. So that's, again, great work. Queenslanders are coming out and getting vaccinated. So we now have 54.84% of at least one dose, and 36.45 are fully vaccinated of eligible Queenslanders. So, of course, it's really important that people get vaccinated. And that's why today we're here at the Mount Warren Park Vaccination Centre, which has just been set up, and they're open tomorrow. They've already got bookings for tomorrow. Then they'll increase to 1,000 vaccinations each day. So if you live around the Mount Warren Park area, please register on the Queensland Health website, and you'll be able to come locally here to this centre. The staff are amazing. I just met them on the way in. They are so excited to be vaccinating the local community here. So it's another example of us setting up vaccination centres, which makes it easy and accessible for people to come and get vaccinated. And as I said, we've seen what's happening in New South Wales and Victoria. We know that this Delta virus can pop up at any time. So I really need Queenslanders to come and get vaccinated. And I'm encouraged from all the conversations that I'm hearing that people are doing the right thing and people are coming forward to get vaccinated. So that's excellent news. Now, the Deputy Premier will give some further information, but we also have some good news today on that border bubble. So we heard that some of those restrictions were easing slightly in some parts of regional New South Wales yesterday. So what we'll be able to do is that students and essential workers will be able to travel from the 12 New South Wales LGAs where restrictions have eased into Queensland. So an essential worker is someone who cannot work from home. So this is going to be great news for those local communities, and we'll be monitoring it very closely, because I think, as they said yesterday, if they do have any positives that come into those local LGAs, they will actually put them back into lockdown. So we'll give those lists of those 12 LGAs where the restrictions have eased, and that'll come into effect from 1 a.m. Monday morning. So it's basically going back to that border bubble that we've had previously. So that's great news for those communities, and will ease some of the pressures along our border. So look, I'll hand over to Dr Young, and as I said, we've just got that information that's come to hand. So look, Queensland, it is really important, if anyone has any symptoms, please come forward and get tested. It is absolutely crucial as we want to prevent the virus escalating in Queensland. We really need the community to come forward and get tested with the slightest of symptoms. And as I said, it's really important that you are wearing your masks. As we know, this truck driver went into a shopping centre. I am comforted in knowing that the majority of people are wearing these masks in shopping centres. So it is absolutely vital that you do that. And finally, the check-in app. It is critical you use that check-in app. We all got to pitch in and help one another. We've all got to do the right thing. And by doing those simple things, we are helping to keep Queenslanders safe. Thank you.
So there are two cases that I have some concerns about today, that it's really important we get this information out as clearly and as widely as possible. So the first is a gentleman in his 20s who works as a truck driver and lives in New South Wales. He was tested in New South Wales on the 5th of September, and we were notified yesterday by New South Wales that that test was positive. He has had, which is good news, 1 dose of the vaccine. Now, he was infectious here in Queensland on the 5th, so Sunday, the 5th of September, and Monday, the 6th of September, and he went to a number of venues. So he attended the BP service station at Archerfield on Sunday from 6:30 to 7:15, and on Monday from 8:50am to 9:30am. Then he went to the Westfield Garden City shopping centre. He went to the shopping centre, the food court on level 2 and the town square over various times on that Sunday and Monday. So he attended Grilled twice, on the Sunday from 8 to 9:30, on the Monday from 5:35 to 6:05. Then he went to the Momo Chicken and Beer area on level 2, Monday from 5:05 to 5:30. He used some toilets at the food court level 2, 5:20 to 5:40 on Monday. He went to Cinnabon on Monday from 5:20 to 5:45. And he went to other areas through the Westfield Garden City. So please, could anyone who's been to the Westfield Garden City shopping centre at any time on the Sunday or Monday, go on our website and have a look at those specific venues and get tested. That's really important. So we've already put multiple additional testing centres in place. So it's really important that people go, because it's now 5 days later, and we know that the Delta variant, which I assume this is, but I don't have that result yet, I assume it's that, transmits very quickly. So it's important that people do that. So that's that case. Then just before this press conference, I was notified of a 13-year-old girl who lives in Sunnybank that we're just confirming. But at this stage, as a very precautionary response, she was at school in the last few days, so we've spoken to the principal. This is the St Thomas More School, Turton Street at Sunnybank. We've asked the principal to advise all children in that school to immediately be picked up and taken home and to go into quarantine for the next 14 days, unless we get other information that would change that advice. But I need them to immediately be picked up from school and taken home, and their whole family their whole household needs to go into quarantine for 14 days while we just work that one through. That's very early information. So then the next important information is that we've heard, due to the what's happening in New South Wales, that those restrictions have been removed for a lot of those border communities, which is really good news for those border communities. So we will be going back to the position before where we had that border zone for those specific LGAs where the stay-at-home orders have been removed. That means Queenslanders who meet one of the reasons to cross the border can go down into New South Wales, and similarly people in those LGAs can come up into Queensland. But it is really important that those people in New South Wales haven't had visitors from any of the lockdown areas in the prior 14 days. They shouldn't have had, because people in lockdown shouldn't be going and visiting other areas, but that's important. And that they themselves haven't had need to go outside one of those areas where those lockdown requirements have been lifted. So it's important, and the best thing for everyone going forward, because we are going to see more cases. We're now up to around 8 truck drivers who've tested positive who've been in Queensland during their infectious period, that it's really important that we're all very careful, and any symptoms at all, as those over 11,000 people did yesterday, which is brilliant, to come forward and get tested. And secondly, the thing we can do to protect ourselves the most is why we're here today. We're at another vaccine centre, is to get vaccinated. That is really important as we go forward. Thank you.
Thank you, Premier. We know how hard these strictest ever border arrangements have been on our border communities, both in Queensland and New South Wales, and we thank them for what they have done to help keep the Delta strain out of Queensland. It will come as a great relief that many of those local government areas in the northern parts of New South Wales have had no new cases and no positive sewage test results, and as a result, New South Wales has been able to ease the lockdown there and return them to restrictions, and that will allow us to allow some further movement within that border zone. This is a revert to the last border setting where people were permitted to travel for a wider range of essential reasons. They will be able to travel for school, for work that cannot be done from home, for essential shopping, for healthcare, or to care for someone who is vulnerable. These arrangements will come into effect at 1 a.m. on Monday. We need some time just to adjust the border pass processes to ensure that these new arrangements can be implemented safely. I want to thank our border communities and particularly our border mayors who've worked with us on implementing this, in particular Gold Coast Mayor Tom Tate, who has provided a range of useful advice about how it is affecting those communities. I also want to thank the New South Wales Border Commissioner, the Deputy Premier, John Barilaro. They've both been very helpful in allowing us to get these arrangements in place, and of course our police and health staff. It's absolutely critical, though, if we are to keep these arrangements in place, that we get as many people vaccinated along the border and right throughout the state. And that's what these hubs are all about. They've proven incredibly popular. I can just tell from the number of selfies taken at the convention centre and at Boondall how popular these hubs are, how convenient they are, and it's great to be opening another one here at Logan. I understand they're hoping to get 300 people through tomorrow. That's 300 more people helping to keep our community safe.
Thanks, Premier. So yesterday on our borders we saw 8,073 vehicles processed, 140 were turned around. We issued 2 on-the-spot fines. With respect to the returning and relocating Queenslanders, overall yesterday we placed 202 persons into domestic hotel quarantine, of which 22 were people relocating to Queensland and 124 were returning Queenslanders. And we have a further 227 persons with current approvals to return to this state. We did issue 4 pins in relation to the 2 at the borders, 1 for a mask and 1 for a person in hotel quarantine who failed to stay in their room and was not following the instructions that we were given, so they were issued with an on-the-spot fine as well. Can I finish off by also mentioning the borders? It's very important that people in the LGAs understand that if they remain in a lockdown LGA, they remain under the current border restriction system and the current border pass system. So there are up to 4 LGAs that are border LGAs, but they do not move to the new system. The new system that will come in on Monday, it's very important that people understand the purpose that they come across for essential work as essential workers, and also the essential purpose. The essential purpose has not changed It remains the same as it was. The essential workers has been expanded. So as you've heard from the Chief Health Officer, if people can't do their work from home, they can come across. But there are other requirements, of course, with vaccination and the like. So people need to understand what the requirements are before they come across. What we don't want to see is people turning up at the border again with the incorrect passes and unable to come across. They can expect up to 100% checking of the vehicles that do come to our borders as per our current posture, depending on what's happening at the time. We will focus on making sure that we keep COVID out of Queensland. And with that, they can be expected to be questioned around whether they have left the declared LGAs or not in the last 14 days, or in fact whether they have had visitors into their premises in the last 14 days. So as always, with any change in our border systems, we do expect delays and there is always confusion. So please, people, can you make sure that you check with Queensland Health website around what's required and make sure that you have the right pass before you come to our borders. Thank you.
Thank you, Premier. Welcome to Macalester and welcome to Queensland's newest vaccination hub. My community has faced a pretty difficult challenge in the last week here in Mount Warren Park in the Windaroo area. I'd like to thank the local community for really coming together during this time. The closure of our largest primary school has had a really big impact on our community, and I'd like to thank those families, the over 1,000 families that did the right thing and were flexible and adaptable enough to go into quarantine when it was required. I'd also like to acknowledge the 100 families, local families that are still in quarantine, those that were using the Early Childhood Centre and the after school hours care. Their continuing quarantine means that we have the confidence locally that we are on top of this here. Now, I'd also like to shout out to the family that I know is currently in hospital, one of our local families, and I know they're doing a bit tough with their kids, so the community is really with you on this. And I know there are many community members here, and I'd like to thank Logan City Council for providing this fantastic venue. This is a community venue, and there have been some, obviously, sporting groups that need to be moved along, but what we are doing in making sure that we face the next challenge is getting the community vaccinated. And once we have those big vaccination rates, it means that our community groups, our sporting groups, can have confidence to continue to compete, to continue to train and continue to represent our local area. So making sure that our local community, and this will have the ability to vaccinate up to 1,000 people a day. So if I can encourage our Beenleigh, our Mount Warren Park and our Windaroo and surrounding communities to come in, get vaccinated and give us the confidence to go forward. Thank you.
On behalf of Mayor Darren Power and Logan City councillors, I'd like to reach out to the Logan community and invite you to take up this opportunity to be vaccinated. We've not only opened Mount Warren Sports Hall here today for our residents, but we've also opened a clinic in Yarrabilba at the Yarrabilba Sport and Community Hub. I recognise that this has created some disruption amongst our community groups who love this facility, and we're working very hard in the background with council officers to try and find a home for those displaced groups. I'd just like to take a moment to acknowledge the council officers who've been working round the clock to get this vaccination clinic open, and I would also like to say my husband, my family and I have all been vaccinated locally, and I'd like to reach out and encourage others to do the same. I'd just like to invite Area Councillor Karen Murphy to come forward.
Thank you. On behalf of Division 12, our State Member Melissa McMahon, the Premier, I'd also like to say thank you for the opportunity to help our families in this area get vaccinated. Thank you to the Council staff as well for being able to bump in this immunisation clinic as soon as possible. I know there has been some disruption, but we will try to make the transition as smooth as possible. So from tomorrow, we hope to have 300 people vaccinated in the area. So Saturday, 1 o'clock, come down, register on the Queensland Health app and get vaccinated as soon as possible. Myself, my family have all been vaccinated, and I encourage you to do the same. Thank you.
Thank you. I might get Dr. Young to address that. Come on.
Yes, the essential workers. So anyone who needs to cross the border to work because they can't reasonably work from home will need to have had at least one dose of vaccine. And that applies both ways. So if there's a Queenslander travelling into those areas in New South Wales, or if there's someone in New South Wales travelling into Queensland.
Can we get some clarification on what is an essential worker? Is a tradie an essential
It's
worker?
anyone, I'm trying to be as clear as possible, it's anyone who can't reasonably work from home. So they need to make that decision with their employer. So it's going back to the setting we were before we had to put those tighter restrictions in place.
Any idea who the school student is linked to? Is it possible she's linked to the truck driver?
It's so early, I apologise. I literally got that information just before coming into this press conference, and they're already onto it and they're already asking a school to close. So I thought it was really important, given I had this opportunity at this press conference, to raise it. But I don't have any information. So we'll get whole genome sequencing back late today or latest by early tomorrow, and then I'll be able to answer that.
I know you've in the past spoken about how one case could lead to a lockdown. If
Yes.
it comes back and the student has been positive and throughout, I guess, infectious while she's been in school, is it likely to lead to a lockdown?
I need more information. Truly, I can't make decisions with 5 minutes worth of information. I literally don't. All the information I've got is a 13-year-old girl has tested positive and they need to close a school. I need to then go and find out all of that very, very important information. I mean, I'm sure you all know the information I would normally want to have.
What can you say about that exemption process for families trying to get into Queensland? Angel's Flight CEO has said that Queensland's process is just too onerous compared to other states.
Yeah, so we're working very closely with all these families. It's a really, really difficult time for everyone. I mean, border closures are just so disruptive. But at this point in time, till we get more people vaccinated, we're at around 36%, which is great. Have had 2 doses, but we just need more people vaccinated, and then we'll be able to work through all of those issues, and more people will be able to rapidly come into Queensland.
Queensland health guidelines say that they should have no or minimal close contact with people, be it rest stops or roadhouses. Why was he at shopping centres and a restaurant and get the donuts and pastries?
Yes, he's currently in New South Wales, so we're asking New South Wales if they could try and get those answers.
Is it also frustrating? I mean, we heard that he was tested on the 5th of September. The result didn't come back till yesterday. It seems a pretty long time to get a positive test result.
Yeah, just remember, though, how many cases there are in New South Wales. There's enormous numbers of cases, and they've all got to be tested. And that's the problem. There's just a delay in getting testing results. In theory, of course I would, but in practice, there's an awful lot of trucks that cross our border every single day. So it's certainly something that I know every single jurisdiction is looking at the moment, but how practical it would be difficult.
Surely rapid testing, though, would be more practical than waiting 4 days for a test result.
Oh, absolutely. Of course it would be. But there's a lot of truck drivers who need to cross that border. It's, in the thousands and thousands every single day, so to hold them up would be difficult. But of course, it's something that we're looking at.
And how confident are you that the New South Wales sewage results are a reliable mechanism to gauge the COVID threat to the border region?
Extremely comfortable. So New South Wales has a very good sewage testing process, and the Border Commissioner has offered to increase that testing frequency, which of course we've taken up. So yes, I'm very comfortable about that process. Sorry?
Was Logan chosen this area?
Yes. Yes. But we are similarly putting vaccine test places throughout Queensland. So please, could everyone go online and find your closest vaccine hub and make an appointment? It's really important. We're getting increasing doses available, so soon there will be plenty of vaccine for everyone, so it's really important that people come forward, get tested, go to your GP, go to a pharmacy, go to one of the Commonwealth vaccine centres, come to one of our vaccine centres. There's plenty around.
Will every car still be stopped at border checkpoints in this new model?
Yeah, well, as I said, we're going to go up to 100% checking. That will be a decision at an operational level, tactical level for our commanders on the ground to look at what's happening at the time, where is it, how many vehicles are involved, what's the level of risk. So, look, I've got great confidence that they can do that at a local level. They've been doing it for a very long time now and doing it very well. Thank you.
Well, as we've said, at a national cabinet level, we are looking to see 80% vaccination rates across the nation, and also, as I have said and others have said too, that any eligible Queensland should be offered the chance to have that vaccination. And I think when you're talking about New South Wales, they're looking at easing some restrictions on that particular date. It's not the restrictions. We don't have many restrictions here at Queensland at all.
And will 12-year-olds be able to get vaccinated from Monday?
Yes.
Will that change these stats going forward, given that we'll have a larger population that will be looking at?
Look, that's a question probably for the Doherty Institute with the modelling about whether or not that cohort is taken into account. At the moment, I don't think it is. But it's a very important cohort, and like I said, it's very urgent for people to get vaccinated, and it's great news that the 12 to 15-year-olds are going to be vaccinated across Australia. I think from memory, California's just mandated that as well, but it's great to see that we have got that opportunity for our students to get vaccinated, and of course then we won't have these issues that are arising where we see a 13-year-old at this stage has tested positive. One thing that's giving me some comfort is that the students are wearing masks. If you remember during that Indooroopilly cluster, they weren't wearing masks. It's something I've been very passionate about, and so is Dr. Young. But we do need to just do some further investigations, and Queensland Health will be updating the public about that through later on this afternoon.
Premier, you spoke yesterday about the exemptions unit
Yes.
possibly getting more staff.
Yes.
At what stage do you think they actually do need more staff, and will they be getting any? Because every day we're inundated with people complaining about the system.
Yeah, like we said, this is a very difficult time for families, and the reason that the exemptions unit does exist is because we have a hard border closure with New South Wales where we are seeing more than 30,000 cases, where we're seeing, I think, a couple of hundred people admitted to ICU, where people are going into their hospitals. And, you know, people are humans and they are trying to deal with these issues as quickly as they possibly can. So I've been given a briefing this morning about it. I'm very encouraged by the senior people that are involved in the exemptions unit team, and you know, over the weekend I think they'll be clearing out if there's any issues there.
People are telling us they're having to wait 10 business days to even get an answer. Is that good enough?
Look, there's probably thousands of people applying. This is not an easy time for any Australian.
In that case, they need more staff. You know, there's thousands of people applying.
I've said we're putting more staff there, so that's exactly what we're doing, but these things just don't happen overnight. So I've made it a priority. I've spoken to senior levels of government this morning about that, and I've made it very clear that I want more action in this area. And, you know, if people are having any issues, you know, please contact that exemptions unit and they can follow up your request.
When can we expect to see those more staff, and how many extra staff members will there be?
Well, that's a matter for the team to work out now. There's, I think, over 70. It was built up to 120. So whilst we do have the situation of the lockdown in New South Wales and Victoria, it probably needs to scale up a bit to around that 100 mark.
Do you want a CT conversion to tourism department?
I don't have a view on that. I haven't seen any reports, so I'll wait till there's any further information that comes to government.
Is that a concern given the impact that's been on the tourism industry at the moment from COVID?
Look, I haven't been briefed by the Minister. I'll talk to the Minister about it.
We've been pretty lucky controlling our outbreaks, but are you worried that the luck is going to run out pretty soon?
Look, I have been very clear that this Delta virus is on our doorstep. It is a clear and present danger. The best thing we can do as the state of Queensland is for as many people as possible to get vaccinated. And I'm encouraged by the numbers of people that are coming and getting vaccinated. And as you can see, the Cairns Convention Centre is going to be starting up on the weekend. We opened Boondall during the week. We've got this centre starting on the weekend. We've seen the success of some walk-ins in Logan. People around the state realise how important it is. And even yesterday, speaking to that distribution centre for IGA and Foodworks, I went and spoke to the individual people who had vaccinated, and they told me their reasons. One person told me they got vaccinated because they have elderly relatives in their family. Another person said that they got vaccinated because they have a young son who's 8. Another person said they got vaccinated for their family. So these are the reasons that people are getting vaccinated. The more people we get vaccinated, the better we stand in combating this Delta virus, which is sweeping the world. I mean, you only have to look at what's happening around the world. It is having a big, big impact. So the best thing we can do is to get prepared now. Get prepared today. If you haven't had your vaccine, register on the Queensland Health website and come on Queensland, let's do this.
I ate a baby rocker yesterday, and this could be a question for the show. About, I understand they've been offered sort of hotel or room quarantine. They want to go back to their rural property.
Yep, look, Queensland Health is working with this family. We will accommodate their requests. I think Queensland Health wants to talk to them. It's also about the care of their baby, to get any emergency medical that they may need. Can I just leave those details to be discussed between privacy with Queensland Health and the family? We want the best for the family, we want the best for the baby, and I know that the top clinicians are speaking with the family. Yep. Yep.
What do you think of New South Wales preparing to look state borders once the reach of 70% double vaccinated for the eligible population? Reportedly against the predictions.
That's for New South Wales to decide. My role is here in Queensland.
Okay.
Thank you.
Thanks everyone. Thank you.